Hello everyone, my name is Dr. Bhushan Ganvir. I am working as an arthroscopic and sports medicine specialist at Lokmanya Hospitals, Pune. Today's topic, what we are discussing is, can rotator cuff injury can be healed without surgery? I think this is the most important topic. So before talking on the topic, before updating on this topic, I just want to update you about the normal anatomy of the shoulder. As we see, the rotator cuff, it is a combination of the four muscles, namely, as you can see in the model, is the supraspinatus, infraspinatus, subscapularis, and the teres major. All these four muscles, they come together and they stick around this bone, what you call the humerus, and this muscle primarily plays important role in the movement of the shoulder, where this muscle helps to take your shoulder to the front, to the outside, to the in and out, right? So most of the patients who come down to the OPD with the MRI, see, doctor, I have got the rotator cuff injury. I need to see on MRI whether it is a partial or a complete, number one. And while having look on the MRI, other important aspect which I need to be aware or I should assess the patient. Number one is the age of the patient. If this injury is encountered in the young patient, age less than 40-45, and the mode of injury, if it's a sports injury or the contact injury, the most likely you are going to get benefited with the conservative treatment. But if your age is more than 60-65 and if the mode of injury is because of excessive use or excessive stress on the muscle, then less likely you are going to get benefited with the conservative treatment, because in this age already your muscle is degenerated, and any excessive loading or stress can result in the disruption of this muscle, and probably, considering the fact this is a degenerated muscle, probably you will end up with surgical intervention where we do arthroscopy, rotator cuff repair, and if you do the good physiotherapy after surgery, I don't see any reason why you should not come back to the norm. Okay, so along with the MRI, the clinical assessment in terms of what is the mode of injury and age of the patient, these are the most paramount important aspect. Along with that, immediately after injury, when you come to your orthopedic surgeon or sports medicine specialist, what is important for me is to assess what is the range of movement. Although you may be having the pain, but if you are having the good range of movement, the probably that indirectly gives me the signal that you can be recovered without doing any surgical intervention. And immediately after injury, our first priority is to make you comfortable in terms of pain and swelling. So we always ask the patient to use the shoulder immobilizer or shoulder sleeve. Second, we advise the patient to use the ice pack. Third, we give the painkiller. And once you are symptomatically better, then we start the physiotherapy. Many of the patients, they ask the same question, okay, doctor, is there anything we can do beside the physiotherapy where that will augment the healing of a rotator cuff or injured muscle? I say yes. I inject stem cell injection, what you call the platelet-rich plasma, into the shoulder joint, where I take 15 ml of blood of you. I process it in the centrifuge machine, and after 5 minutes of centrifugation, I get platelet-rich plasma, which I inject under accepted precaution, which can be done in the OPD process. And this is injection that not only helps to reduce the inflammation, but it also helps for the healing and the regeneration of the torn muscle. So if we combine the proper clinical assessment, MRI, and the stem cell injection, we can definitely give the maximum benefit to the patient, and I can really help you to get back to your normal shoulder activities without doing any surgical intervention. So I think this is all about the rotator cuff injuries. If you have any suggestion or any question, please drop your comment on the comment box. Thank you very much.